DH, and thanks to my fellow speakers for your excellent contributions. Dr. Dhanapal's done an excellent summary of the current climate in the UK and what we're facing at the moment. And I must say, being in Oxford, which has been the heart of the development of the AstraZeneca COVID vaccine and research at a time like this, has been incredibly interesting. Something to note is that the UK government had prepared for a pandemic virus and being able to rapidly deploy a vaccine well before the pandemic. So when the SARS and MERS pandemics happened, the Oxford Vaccine Institute had actually made an agreement with the government that in an event of a widespread pandemic, they need more investment and facilities to rapidly ramp up vaccine production should there be a case. And when COVID-19 came along, we were pretty well prepared to meet that situation. And another important thing to note is that, you know, the UK is very different to India and Tamil Nadu in terms of our resources. We know that. And also in terms of population, as Dr. Dhanapal said, the size of Tamil Nadu is the equivalent of the whole of the UK. So it's very important to keep that in mind when we discuss our opinions and possible strategies towards tackling the virus. In terms of our vaccine rollout, another important point that the UK government has emphasized is the use of existing facilities to roll out the vaccination. So in terms of designing our COVID vaccine hubs, we've tried to make use of, as much as possible, existing, hospital infrastructure, schools, and of course our general practice facilities. When looking at mortality due to COVID-19, I know DH has asked the question of why have high income countries had a higher death rate compared to countries like India and South Africa, etc. And an interesting bit of research that has come to light recently is that of the protection that's conferred from our microbiomes. So our natural microbiomes in themselves that develop as we're growing up through exposure to environmental bacteria and such, can often give us quite a robust immune response, which is one of the theories that has been put forward to why we have not seen the high death rates in the developing world compared to the developed world. That's in addition to what Dr. Dhanapal mentioned about, that we have more elderly people and that testing and tracing may not be as adequate. So some very interesting research being done in that area at the moment, and hopefully will help us try to explain why we're not seeing as many deaths. So when we compare deaths, or what we call mortality, side by side, we can see that India has actually had 10 times less deaths per million in the UK. And that's incredibly important to remember, that as much as, we hear our daily statistics of the number of people dying per day, per week, the number of cases, when you look at the trend over time and from the start of the pandemic to now, that in fact, you look at the UK and US, they're 10 times more deaths per million. And as I said, there are various factors that may have been responsible for that. Another area of research that's being done on COVID-19 is, and being actively researched in the UK at the moment, is that of long COVID. So the UK has recognized long COVID, which is a group of symptoms that may predominate after COVID-19 infection, such as fatigue, headaches. It's a wide range of symptoms that may go on for months after COVID-19 infection. And this is an entity that needs to be recognized and dealt with by our health systems. And in saying that, the NHS is preparing to roll out long COVID clinics and provide long COVID care. So that's something that the Indian health system needs to prepare itself for. And not to forget the indirect effects of the pandemic on the health of its people. So the fact that our primary healthcare services were reduced due to the effects of lockdown, the mental health effects, these are all things that we need to, in any health system, now prepare for in the aftermath of the first wave. Going back to the vaccination, I completely reiterate Dr. Danapal's views that everyone should get vaccinated. It's the only way out of this at this point of time, and it's the ray of light for all of us. And as it stands, both vaccines that are available in India now, the Covaxin, which is from Bharat Biotech, and the Covishield, which is from Bharat Biotech, and Covaxin, have been approved in India. However, I must say, in my personal capacity, that having, read around and researched the Bharat Biotech Covishield Covaxin vaccine, that there are definite ethical issues with the way in which the trials were conducted. And I think that the Indian regulator really has its work cut out for them in terms of deciding what to do with certain information that's come to light. And I think it will be important in the coming days for the Indian government to try and diversify the range of vaccines that it's making available to its people. So the Serum Institute of India vaccine, which is related to the Oxford vaccine, great. Bharat Biotech, I personally feel needs more review. There are many ethical considerations in the way the trials were performed. And I think that the Indian government needs to look at agreements for the other vaccines that are out there, such as Moderna, Pfizer, etc. Thank you.
So I have a question to you, which I've been asking every other panelist. So what do you think about the Bharat vaccine? So as I asked the previous panelists as well, there have been a lot of controversy surrounding the Bharat vaccine, that they haven't followed the procedure. Since I think you have worked on vaccine development and so on and so forth. So do you think the procedure was followed? If it wasn't, what do you think are the worrying points? Why do you think we should worry about the procedures not being followed? And second thing is also, what do you think about the Oxford vaccine, relating to the efficacy and efficiency?
So in terms of the ethical issues around the Bharat vaccine, I think if I'm to list the issues that were found, it's that trial participants, clinical trial participants were subject to financial inducement. So they were paid a certain amount to take part in the trials, which is normal practice when running clinical trials. But given that they targeted specifically poor, impoverished groups of the population for the trials, that brings into question, the ethical considerations in recruiting these participants. And there's also information that's come to light that informed consent was not duly followed, and a copy of the informed consent was not given to trial participants. For illiterate participants, there were no audio-visual recordings done. So we're not sure how consent was taken from illiterate participants. And there was a fatality. There was a patient who died during the trial, and this was not made public until the media reported it. And then Bharat Biotech then issued a press release around it. So, and even then, the Indian medical regulator only halted the trial for a very short period of time. And that brings into question, what sort of trial conduct was there? How much can we trust their results? We have specific ethical approval and processes in place for drug development and trials that need to be followed for a reason. And all of these things brought up massive ethical considerations, which were not flagged in any of the other trials that have been approved by reputable regulators. We did not have those issues with Pfizer, Moderna, and the Oxford AstraZeneca vaccine. So that's my take on the Bharat vaccine. In terms of the Oxford AstraZeneca vaccine, So an estimate as to the efficacy has been put from 70 to 92%. And I think what's important to note is that there's this huge focus on efficacy of the vaccine, but we're not necessarily looking for efficacy. It's more that are we preventing severe COVID-19? And in the case of the Oxford AstraZeneca vaccine, the severe COVID-19 is prevented in 100% of cases. And to me, that is an argument in itself of preventing, of using the vaccine, because that will mean that our hospitals do not get overwhelmed by patients needing ventilation and needing critical care. So that's an important thing to focus on. Yes, efficacy is important. We will learn more about its efficacy as we use the vaccine more, but preventing severe COVID-19 should be the focus, because most of our countries do not have the healthcare system to support a patient population that is overwhelmed by severe COVID-19.
My next question revolves around geopolitical vaccine politics. So I read recently in a foreign post article about several African leaders ruing about the fact that vaccine availability in African countries are really bad, and many African countries wouldn't have its citizens vaccinated until 2022. And they went and said that if you don't vaccinate Africa, again, how much you vaccinate your people, COVID is still not going to be controlled. So, what do you think about the vaccine delivery in Africa, and what is your opinion and take on it? Since you're also from South Africa and you've also researched a bit about public health in Africa.
So just like India, we haven't seen the same number of deaths as most of the developed Western world. In South Africa specifically, we found that in South Africa, a lot of our Southeast Asian populations and Indian populations have been more severely affected by COVID-19, funny enough, than the rest of the population. So we're finding that some ethnic minorities seem to have an increased risk of severe COVID-19. In terms of the public health response, because most governments in Africa have a long history of poor health infrastructure, massive corruption in the healthcare system, we have not been able to deal with and handle and contain the pandemic as well as the West. And unfortunately, those cracks are showing themselves in terms of we have overwhelmed critical cares at the moment. Critical care capacity, I think, is about 10% nationally at the moment. And our doctors and nurses are overwhelmed. We do not have enough PPE. So things aren't too great. So in South Africa at the moment. In terms of securing a vaccine, we have agreements with Oxford AstraZeneca in South Africa and with the Serum Institute of India, who will be providing the vaccine for our frontline healthcare workers in the first instance. However, I think apart from South Africa, the rest of Africa is very much dependent on the COVAX vaccine facility. So that's been led by the Coalition for Epidemic Preparedness and Innovation, CEPI, and Gavi, the Global Vaccine Alliance, which has made financial provisions and agreements to provide vaccines to the rest of Africa at a reduced cost. So we'll see in the coming months how that facility is going to be used, how many vaccines are going to be made available. But that COVAX is basically the only reason that a lot of the poor countries in Africa are going to have access to vaccines in the coming months.
Thank you, Reshania. I have one last question for you. So, since you're also a public policy and rather public health expert, coupled with your medical degree, I think you'll be able to advise us on the direction in which the public health policies of developing countries should take. So, COVID has taught us a big lesson. So, what do you think of the policy recommendations, immediate policy recommendation for developing countries such as India, South Africa? And also, what is your opinion on the spending these countries do on public health?
I think it all comes back to health system strengthening. So if we don't have a strong health system supporting the country, then we can't do anything. So, the number one recommendation would be, increased health spending, increased health system, strengthening. And in order to do that, that's going to take increased human resources. So doctors, nurses, ramping up training, and also ensuring that we keep these doctors and nurses and healthcare workers in the system. I think the developing world is facing a massive issue with our healthcare workers leaving to greener pastures, and we need to do more to retain and keep the best talent. And secondly, I think pandemic policy and preparedness needs to be ramped up, and I think a lot of countries were caught unaware. Um, I think like parts of Asia, Korea, etc., were a bit more well prepared because they'd had SARS. So their policies were more updated. I think the rest of the developing world needs to learn from this and devise pandemic disaster policies.